everyone. Today, 10th of September is World Suicide Prevention Day. It is an awareness day conducted to provide worldwide commitment and action to prevent suicides with various activities since 2003. The International Association for Suicide Prevention collaborates with the World Health Organization and the World Federation for Mental Health to host World Suicide Prevention Day. Suicide has a number of complex, interrelated and underlying factors that can contribute to the feelings of pain and hopelessness, which ultimately leads to the thought of killing oneself. Here are few ways in which you can prevent suicidal thoughts.
Suicide prevention starts with recognizing the warning signs and taking them seriously. If you think a friend or family member is suicidal, there is plenty you can do to help save a life. Determine the patient's current protective factors, internal factors and external factors. Internal factors such as religious beliefs that influence the patient's ability to manage stress and frustration. External factors related to the patient's environment such as family or pets, positive relationship and a good support system. Ask the patient about thoughts to kill someone else and identify the planned means, behaviors and intent if the patient has such thoughts. Encourage the patient to speak openly about any self-injurious behavior.
Immediately direct a patient who is actively engaging in suicidal behaviors, that is in the process of cutting self, attempting a hanging, taking an overdose, to stop. Remove or ask the patient to relinquish any objects that may be used for self-harm. Contact the mental health practitioner as soon as possible and give as needed medication to assist with reducing anxiety or psychosis. Search the patients for contraband such as medications, belts, drawn strings, shoelaces, razors, plastic bags or mirrored items. Maintain the patient's privacy and the dignity during the search. Remove the items and secure them out of the patient's possession per the organization's practice. Patients may try to hide contraband to use for self-harm later. Removing the means of suicide and maintaining a safe environment are the effective suicide prevention strategies. Make sure that the patient is taking medication as prescribed and not pretending to swallow it or stashing it for a later overdose. And also make sure to monitor for suicidal ideation or behaviors in children, adolescents and young adult patients who have started on antidepressant medications.
If you are having suicidal thoughts, contact the National Suicide Prevention Lifeline at 1800-273-8255 for support and assistance from a trained counselor. If you or a loved one are in an imminent danger, call 911. Be a good listener. Being able to talk with a caring friend and unburden yourself from your troubles can go a long way in relieving the unbearable buildup of pressure that can lead to a suicide attempt. Being a good listener doesn't require any special skills. Be patient and accepting, but avoid getting into an argument or trying to offer simplistic solutions. Encourage them to get help. Even though some suicides may seem to come out of the blue, it's quite likely that the person has been depressed for a very long time. Ask about their suicidal feelings. While you may be afraid to bring up the topic of suicide for fear of giving them ideas, the fact is that those thoughts and feelings are theirs regardless of what you might say. What you are really doing by bringing up the topic is giving them an opportunity to open up to you and allow you help them. Don't leave them alone. If they seem to be in an imminent danger of hurting themselves, do not leave them alone. Take steps to get them away from any means that they could use to hurt themselves, such as weapon or pill.
I was made for love, and the name it gave me. I was made for the great experience in life. I was made to be a sister and a friend to my siblings, to be furiously kind and relentlessly gentle. I was made for a second chance, so I will choose to stay, for experiencing wonder and awe of the world we live in. I was made for sunsets, and there are better days to come. Moreover, this too shall pass. And so, I've realized ending my life is not a solution to my problems. I would rather stay strong and courageous and face them by any means. I know there are people around me who supports and loves me for who I am. I know I have a purpose in this life, and so I will move on.
There are people waiting to meet you, people waiting to love you. There are people that stand still until you've stepped foot in them. There are undiscovered miracles in the tomorrow. They exist for your arrival. Arrive there. By encouraging, understanding, reaching in, and sharing experiences, we want to give people the confidence to take action. To prevent suicide, we have to become a beacon of light to those in pain. You can be the light.